In the run-up to the UK election, we want to use this time to take you through our oral health manifesto point by point. We hope that policymakers take this opportunity to brush up on their oral health knowledge so that they can better equip the country with what it needs. Right now, we're focusing on bringing back oral health promotion teams.
I mean, many years ago when I first started in dentistry, pretty much every health authority, obviously they go through different names and, different guises that they call themselves these days, had an oral health promotion team. Now, this team were a team of oral health educators normally who would be able to go out to schools, give talks, schools, nurseries, workplaces, just giving dental prevention advice. So going through all of the basics, toothbrushing, diet, visiting your dentist, looking at the whole mouth and giving that information. So it's almost like saying, right, we have so-and-so percentage of people that go to the dentist. So we've got a good percentage of people who don't get any dental advice or any dental instruction ever because they don't go to the dentist. So now more than ever, we really need these teams back again. They started being dropped because I suppose it's a quick money saver. You can get rid of a team. Depending on the size of the authority, there could be a number of people working within it. So they were reduced, and now we don't have too many. But it's really important that we, bring these back. I mean, they are, it's an investment for local authorities, yes, but what they bring is so much to areas of deprivation, areas where there aren't that many dental places, because let's face it, people are finding it difficult to find a dentist. Whatever happens, it's going to take a while to reinstate dental places for all of those people who want to see an NHS dentist to be able to see one. It's going to take a long time. Now, getting a health promotion team in working is going to be so much quicker. So again, we're looking at somebody going in, catching kids when they're in nursery. You may see them again when they go to school. You may see them again as they go through the school's education system. You may even see them when they go into a workplace. But it's really, really important to start these good habits early. And like we were saying before, prevention is so, so, so important that we just need to make sure that these teams are there to play this vital role in education, prevention, and early detection of oral diseases. Because I don't know whether you remember, I don't know whether it happened in your area, but the school dentist used to come around and you used to get a little slip if you needed to see another dentist. So this is a long time past.
Yeah, I can't
now whether
say,
it
I don't think I've ever had someone come into school
no
dentists. No.
it probably wouldn't come back to that, but you've got somebody that who will be able to advise you if you've got a dental problem, what you can do about it. So it may not be sort of as in a dental practice, but it's you're looking for somebody talking to you, maybe saying, I've had this mouth ulcer and I've had it for a little while, and things like that could be missed. The health promotion team could pick up that. I mean, the clue's in the name. It's oral health promotion. We're promoting good oral health, and it's really, like I say, I can't stress how important it is to start people early and getting these skills for life. And just having somebody, I mean, how many times do we get asked, can somebody come out to my school and give a talk? I mean, 2-3 times a day.
Dozens, yeah.
And we can't do it. We don't have the resources. As much as I would love to do it, and if we could do something via Zoom or something like that, brilliant. But if we had these teams in every area, that would be their first port of call, and they could get someone to come and do the whole you know, you couldn't do it in one session, but you know, to maybe have a couple of sessions to go through your toothbrushing, your diet, you know, lots of different things that we can help people with, and knowledge is power.
It
You know,
is.
the more we teach people, the better it's going to be.
And a stripped back version of that, even when I've went in and done assemblies in schools and things before, that's another way you can do it, where you're speaking to a year group at a time, giving a basically like a little mini assembly, a little lesson, a little talk, and they take in a lot. Like, you'd be surprised. So
Yeah.
even something like that, going and spending a morning in a school, and there's no reason that it doesn't there's a lot in between going in and speaking to every child and giving notes about if you need
Mm.
more help, and then nothing. Like, this is a nice middle ground, at least for
And
me.
also, it's about analysing also what oral health promotion teams do is they analyse the data that's coming from their area on how the oral health is in their particular area. So what areas are performing better than others, and is there some areas that have poorer oral health than others, and trying to work out why that is and what they can do to stop that. So it's much more localized rather than saying the country as a whole, you know, has this amount of dental decay in kids under 5. It's more specific to their area. And I think that's really important then, that they then can target those particular areas because they can see a need. And I think that's important. I mean, obviously they're not sitting there waiting for somebody to phone up and say, can you come and do us a talk? It's much more involved in looking at the epidemiology of what's going well and what's not going quite so well, and where the resources need to go to, really.
Read the full manifesto on our website and get in touch with your local counsellor to see what they're planning to do to improve the oral health in your area. Next time we'll talk about bringing toothbrushing programmes into early years settings and schools.